Hey guys, this is Darshana Modi, and I'm a peer mentor at Rutgers University, Newark campus specifically. This video is about 7 things you guys should definitely keep in mind during your clinical routines for the Rutgers School of Nursing. And this goes for also any nursing program in general, globally. Alright, so let's get started. First one is have all of your vaccines done, specifically your flu vaccine, by middle of September. So you can go to your local Walgreens or CVS to get that done. Second thing is be at clinicals on time. You may run into traffic, you may find it hard to find parking, you may be unfamiliar with the hospital setting, so definitely leave 30 minutes earlier. In other words, if the GPS says that it takes 1 hour to reach the clinical location, leave 90 minutes ahead. Alright. Third thing is be ready to do a lot of head-to-toe assessments. So for your health assessment class specifically, you've been learning about all the different systems and what to assess for. So you want to be familiar with that because you'll be doing a lot of that during clinicals. You'll be also taking a lot of vitals and helping UAPs, which are unlicensed assistive personnel, with basic tasks like bathing, changing linens, feeding patients. Fourth thing to keep in mind is that you'll be doing a lot of nursing care plans throughout the year. You may be doing one, or you may be doing one per week. Depending on the semester and instructor, all varies. Some resources that you could use for your nursing care plans is your Lippincott website. Under content, there's a category called Advisor for Education, so definitely look into that when you're doing nursing care plans. Another website is Nurse Labs, and the third resource that I definitely like to use is nursing care textbooks in the GA floor in the Stanley Bergen building. Definitely use that. It's in the nursing lounge and there's tons of textbooks there. So definitely check that out. Fifth thing is be ready to know your lab values. Also know the most common meds on your unit. A lot of common meds that you may see in the hospital setting in general is heparin, insulin, BP medications. So know their usages and their side effects. Sixth thing is be ready to know all about your patient by mid or post conference. Your instructor is going to ask you what kind of day did you have. You want to know everything about your patient. You may have multiple patients, but know at least everything about one of them. So for example, if you had a stroke patient, did you see any differences in left and right side assessments? If you had a second day post-op patient who just came back from hip replacement surgery, did they use any specific devices to help them ambulate? How was your range of motion? Third scenario would be a patient with MRSA. You have to be in contact precaution. So how did you use contact precaution? How did you take assessments while you're using contact precaution? Seventh thing is be ready to be flexible. All right, this goes for not only Rutgers School of Nursing, but every nursing program out there globally. Not everything is going to go as planned. You may have clinicals, for example, every Wednesdays from 8 to 4 p.m., but because of some policy in the hospital, those timings have to change after 2 weeks. But for the most part, your clinical days, times, and locations will be consistent, so don't worry about that too much. If a change does occur, however, it's usually out of your professors or your instructor's control, so just try to be cooperative and don't give them a hard time. One last additional thing I want you guys to keep in mind is that you all are representing Rutgers School of Nursing. So when you're in the clinical settings, be at your best behavior. Treat the patients with non-judgmental attitude. Show that you're interested in patient care. Be familiar with as many tests and medications as possible. You want to show that you're knowledgeable. But if you make a mistake, it's okay. This is a learning process, so don't make a big deal out of it. Don't let yourself down. This is a learning process. As long as you show enthusiasm and show that you care and show that you're interested in what you're doing, they'll be happy to have you. So just keep that in mind, and overall enjoy the clinical experience. This is the only time for you guys to really gain that clinical interaction in nursing school. So make the most of it. Try not to be absent if you don't need to, because eventually you're going to have to make it up. So don't make silly excuses not to go to clinicals, because this is your opportunity to learn. And yes, some of the stuff that you learn in clinicals show up on your exams. So it's really important that you attend clinicals. All right, so happy clinicals. Enjoy the process, and let me know if you ever need anything. Thank you. Signing off. Bye.